talk about tonsillectomy and give you a little overview of what it's like to take out the tonsils. Taking out the tonsils is still one of the most common procedures that's done in the United States every year, so chances are you've heard from some family or friends how tough it can be. But if you have enough problems from the tonsils, it probably makes sense to take them out. The most common reasons to take out tonsils center around either infections or obstructive symptoms or blockage type issues. From an infection standpoint, it can mean that you're getting a lot of episodes of tonsillitis where they're getting swollen and red and drippy over and over and over again. If you have enough of those episodes, it might make sense to take them out. Sometimes we take it out for chronic or severe infections. So even if you only have 1 or 2 episodes, if they're bad enough, if they last long enough, certainly if you get an abscess, it might make sense to take them out as well. Some of the obstructive reasons where we may take out the tonsils are for obstructive sleep apnea, which chops up your sleep and gives you poor sleep quality, swallowing problems where you're gasping or choking or having trouble getting things down, speech issues where it's very muffled and hard to understand, then those are all reasons from an obstructive standpoint that we may take out tonsils. Chronic mouth breathing can also lead to changes in jaw and facial development, so in kids sometimes we're doing it to prevent growth and development issues of the jaws. Some more rare reasons to take out the tonsils would be for tonsil stones or for a lump or mass and a concern for cancer. Ultimately, the surgery itself is pretty easy. It only takes 10 or 15 minutes, but you've got to be completely asleep. It is the back of your throat, it is kind of sensitive, and for people who are wide awake, it's just too gaggy and sensitive. So once you're asleep under general anesthesia though, it's a pretty straightforward process that takes 10 or 15 minutes. We reach in the back of the throat when we peel the tonsil out from the muscle that's underneath. Once that's done, you've got an open raw area in the back of your throat that needs to heal. Most people who get their tonsils out get to go home the same day. But for small children under 3 years old, or for people who have bad enough sleep apnea and sleep issues, they may need to stay overnight. Once you get home, the main issue that people deal with is a sore throat and trouble swallowing. Generations of kids have gotten through it with popsicles and ice cream because cold things that melt can be soothing, help with swelling, but it's also the easiest thing to swallow. Within a few days, you get to soft foods like mashed potatoes and grits that are at room temperature, and then to semi-solids like mac and cheese that are slightly lukewarm. Eventually, you get back to solid foods that are hot like hamburgers or pasta. Ultimately, though, it might take you 3 weeks to get back to Doritos. In general, there's enough pain and discomfort that people are taking Tylenol and Motrin around the clock that first week. You're marching it out usually in a 6-hour cycle, so if you're taking Tylenol every 6, Motrin every 6, and you alternate them, you're taking something every 3 hours. So for example, Tylenol at noon, Motrin at 3, Tylenol at 6, Motrin at 9. The older you are, the more likely you are to also need a narcotic like morphine on top of that. If you end up taking a narcotic, that's fine, but it's on its own schedule and doesn't replace the Tylenol or Motrin. Most people are able to dramatically taper down on the pain medications after the first week. Because of the pain and discomfort and trouble swallowing and trouble sleeping for that first week, almost everyone is home from school or work. The second week, most people are able to go back as long as there's not significant strenuous physical activity. So for children, this may mean no swimming, no trampolines, no PE. For adults, this means no sports, no working out, no swinging sledgehammers, no doing construction. But if what you have is a desk job or you're going to school and sitting at circle time, that's fine. Whether you go back to school or work that second week is up to you. In general, as long as you're not doing anything really strenuous from a physical activity standpoint, it's fine. That having been said, we all know people that can't function when they're a little bit sick or under the weather, and other people who are able to power through everything. Medically, it's safe to go back. Whether you feel up to it is a different story. For children, that first week is very tough. It's going to test all of your parenting skills and patience to get through the process, but you will get through it. The more you stay ahead of the pain, the better. The more you force liquids and stay hydrated, the better. It actually doesn't matter if you can eat anything for a whole week or so. You might lose a little bit of weight, but medically you're going to be fine. The most critical thing, though, is that you're able to get liquids down and stay hydrated. That's going to be crucial to your successful recovery. Most patients worry about the pain. Most doctors worry about the bleeding risk. So once you've taken out the tonsils and you have the open raw areas that are trying to heal, during that healing process, the scabs can fall off and you can start coughing and spitting up blood. Thankfully, it's pretty rare. It only happens about 3% of the time. When it happens, it can be any time from the moment you hit the recovery room all the way through a 2-week healing process. Once you've hit that 2-week mark, the bleeding risk is gone. But during those 2 weeks, we don't want you to be on an airplane, on a boat, or camping in the middle of nowhere. We basically just want you somewhat near civilization and on the ground and near healthcare should anything happen. Most of the time, if you start coughing and spitting up something red, it's going to be mild and just little flecks of blood in your spit or your phlegm. If that's the case, sucking on some ice chips or popsicle or gargling with ice water may get it to stop. The risk where the bleeding is significant enough where we need to reach back in there and cauterize or put in a stitch is only about 1%. In older children and adults, we can generally do that in the office. In freaked out little kids, or even anxious adults who may perhaps have a very sensitive gag reflex, might need to go back to sleep in the operating room under anesthesia for 5 minutes just to get in the back of the throat. The likelihood where you bleed enough where you get a transfusion is less than 1 in 1,000. It's not high at all, but it's not zero. Almost always in children, they're completely recovered in 2 weeks. For quite a few adults, it can take 3 full weeks to be completely recovered. I know it sounds like a rough recovery, and it is, but everybody gets through it okay. If the reasons that you're going to consider taking out the tonsils is bad enough, then another way to think about it is packing in all of your future suffering from the tonsils into those 2 or 3 weeks, biting the bullet, getting it over with, and moving on with the rest of your life. One last note, we almost always take out the adenoids when somebody's getting their tonsils out. Adenoids are very similar to tonsils but live behind the nose in what we call the nasopharynx. If you think about the area where you're drinking a soda, you lap and it squirts around the back, that's where the adenoids live. Because you can't see them easily by just opening your mouth in the office, people a lot of times forget or don't even know that they're there. But taking out the adenoids is a super quick and easy procedure, and if you're going through a tonsillectomy and if you have any adenoid tissue at all, we pretty much always take it out at the same time. I hope this gave you some useful information about what the tonsils are and when we would take them out. If you have any additional questions, please leave it. And I'm an otolaryngologist, head and neck surgeon, otherwise known as an ear, nose, and throat doctor here in Los Angeles. And I wanted today to talk about tonsillectomies and post-tonsillectomy bleeding. Taking out someone's tonsils is still one of the most common surgical procedures that's done in the United States every year. It can be done for a variety of different reasons, but the end result after that 10 or 15 minute surgery is that you have open raw areas in the back of the throat that need to heal. As it's healing, it might bleed. Think of it like falling down and scraping your elbow. There's a little bit of a road rash. You can't close it, you can't cover it, you can't stitch it. It heals with a scab. Gradually, over about a 2-week period, skin relines the area, scab falls off. As that happens, there may sometimes be bleeding. The actual amount of bleeding in the operating room tends to only be about a teaspoon, virtually nothing. But post-operatively, at any point from the moment you hit the recovery room all the way till the last piece of scab is gone, which is usually about 2 weeks later, it is possible that you start coughing and spitting out blood. Thankfully, that only happens about 3% of the time, or 3 patients out of 100, which means 97 patients out of 100 don't have anything red coming out at all. If you happen to be the unlucky 3%, most of the time the bleeding is quite mild. You might just be coughing or spitting up little specks of red in your phlegm. If you're the 3%, most of the time we can get it to stop with something cold, either gargling with ice water, sucking on ice chips or popsicles. The cold temperature gets the blood vessels to clamp down. Now 1% of the time, or 1 patient out of 100, the bleeding continues or is dramatic or aggressive enough. In those cases, in a cooperative older child or an adult, it's like going to the dentist. You come into the office or the emergency room, and usually we can reach into the back of the throat and cauterize or stitch or do something to get it to stop. In small children, and even some adults who have a hypersensitive gag reflex, where there may be some anxiety, we can't get to the back of the throat, it is possible that we need to go back to sleep under anesthesia for 5 minutes just to get into the throat. Again, that's about 1 in 100 patients. Certainly not a high number, but not zero. Another important note is that because the bleeding risk lasts for about 2 weeks post-operatively until the last little piece of scab is gone, During that time, we don't want you on an airplane, we don't want you on a boat, and we don't want people camping in the middle of nowhere. Basically, if you happen to be the unlucky few percent where there's bleeding, we want you on the ground near civilization and near healthcare should anything happen. The last place you want to be is on a cruise or in 30,000 feet in the air where there can be a significant delay in getting to care. Sometimes we get asked by family members or parents if they could donate blood and have it on hold for the patient if they should develop bleeding. As with any blood donors, the blood would still need to be screened to make sure that it's the right blood type, that there are no infections, and no reasons why the blood can't be used. But another obstacle is that the blood needs to be held on for over 2 weeks during the entire post-operative period in case anything should happen. It's not something that we usually worry about in the operating room. The 3% risk of any bleeding and the 1% risk of needing something done is if you're doing everything right. Certainly there are situations or circumstances where the bleeding risk may be higher. If you or your family has a history of bleeding disorders like hemophilia or von Willebrand's disease, certainly let your doctor know before surgery. There may need to be things that are managed differently in the perioperative process. Additionally, if you introduce foods that are too solid, too crunchy, too sharp, too scratchy, or even too hot in temperature too early in the healing process, that can increase the risk of bleeding. We also want people to avoid any strenuous physical activity. Anything that gives you a sudden surge in blood pressure or heart rate, and certainly anything that gets your blood pressure up too high and the little veins in your head popping out, that's going to increase the risk of bleeding in the back of the throat as well. So try not to do anything too strenuous. That having been said, we absolutely want people not to lounge around on the sofa or in bed all day long. That gives you a risk of blood clots. We want you to get up, we want you to get around. It's okay to do some light physical activity, things to get the juices flowing a little bit. We just don't want those little blood vessels and veins in your head popping out. I also wanted to go back to the bleeding in the operating room. I mentioned earlier that it typically is a teaspoon or less. Again, that's true if you don't have any history of bleeding disorders, but we also want to make sure that you're not taking too much aspirin, Advil, Motrin, ibuprofen pre-operatively for a few weeks. If you're on those type of medications, and certainly if you're on Coumadin or warfarin, it can dramatically increase the risk of bleeding in the operating room. Also, there are some vitamins and supplements that may increase the risk of bleeding, so please talk to your surgeon prior to surgery about what you're taking. I hope this information helps and clears up some of the concerns around bleeding after tonsillectomy. Most people are highly concerned about the pain and discomfort and the horror stories they've heard from family and friends. Medically, as a surgeon, what I actually worry about most is how to manage bleeding.